It's just great. We have one more story for you, one more to cap it off, and this one just really spoke to my heart. I had an opportunity to do this interview not too many days ago with Holly Rioux, who's the Director of Deaf and Hard of Hearing Services in the Greater Nashua Mental Health Department. So, serving the needs of residents of Greater Nashua since 1920. Today, this office offers comprehensive, integrated, whole-person care to nearly 5,000 people. And Greater Nashua Mental Health has a $1,500 match. So, think about that as you're listening to this wonderful interview and conversation I had with Holly Rioux.
Hi, Holly. Thank you so much for joining us and talking about the Deaf Services Program through Greater Nashua Mental Health Center. Why don't you take a couple minutes and tell us a little bit about those programs?
Absolutely. Thank you for having us. So I'm coming from Greater Nashua Mental Health, Deaf and Hard of Hearing Services Department. So Greater Nashua Mental Health is one of the mental health centers in the state of New Hampshire, but we are the only program that's statewide for community mental health programs for the deaf and hard of hearing population. So on staff right now, there are 6 deaf people at Greater Nashua Mental Health, and we will have 2 more coming soon. So our team has grown in the past 3 years during the pandemic, with more deaf professionals coming to join the area for working at Greater Nashua Mental Health. So we have a whole team of signing and deaf providers who provide direct mental health services to the New Hampshire deaf and hard of hearing community. We've been here since 1995. And our funder has been the same the entire time. So while we've grown, we've been able to increase the services that we provide to the community. And we're able to travel to meet people in their homes and areas. And we also have been able to figure out technological solutions for meeting virtually during the pandemic. In the past 3 years, we've expanded the scope of our services to include integrated healthcare with community health worker who's deaf. We've also expanded to provide supported employment services with someone who is a qualified signer and experienced in the deaf community. She provides supports to individuals who are looking for a job. So research shows that the deaf community nationwide, if they need mental health supports, 88% can't get the mental health supports that they need. But that's definitely not true here in New Hampshire. We're above the curve because of the robust team on the Deaf and Hard of Hearing Services Department that we have. So that's one thing we've definitely been working to break down that barrier. It's definitely not 88% cannot get services here in New Hampshire. Another statistic is that nationwide, the unemployment rate is as high as 48%, and it's worse for people who are deaf or hard of hearing and have mental health challenges. So our goal is to break down all the barriers and provide culturally and linguistically competent mental health services to the community.
This is wonderful, Holly. I'm curious to know, besides the obvious communication challenges for the deaf and hard of hearing, are there unique mental health challenges that these folks face every day?
Yes. Unfortunately, our community is at high risk for trauma and victimization. And also, unfortunately, deaf children, their risk for physical and sexual abuse is as high as 50%. So our goal is to protect our community as much as we can. That's what we see as a lot of trauma, the percentage is pretty high in our community. Also, anxiety. So, for example, 90% of deaf people live and are born with hearing families. So that means that their ability to communicate with their family members is often a big challenge. And there's a lot of communication and linguistic barriers. And it's a significant challenge for parents too, because if they want to communicate with their own children, they have to learn a whole new language. So there's a lot of anxiety related to family and also with growing up in a hearing world.
Obviously, those services you offer are a wonderful, wonderful aid for these folks that have this unique and special ongoing need. Tell me about the successes of your program and what you see as the impact on these folks' lives.
Sure. So since we've implemented our supported employment program, we have been able to effectively support 12 individuals since last fall with looking for jobs and identifying their goals for themselves. And we provide, weekly or daily support for looking for a job through their mental health services here. So that's one thing we're really excited about for recent implementation. Another thing is we have an on-site primary care here at Greater Nashville Mental Health that we can get a deaf community mental health worker and a community health worker to go to. Because a lot of the time the integrated care or the care for primary versus mental health is separated, but here at Greater Nashville it's integrated care. So they can get physical health care and mental health care at the same time. And then also our ability to hire deaf mental health professionals has grown, which also means that there's a higher demand for services for our deaf professionals here on the job. And it just keeps going up. So we're looking to expand our ability to provide access on the job, including staff interpreters. We need one more. And then the second thing we're looking to expand is our ability to provide crisis solutions that match the state's 988 rapid response approach. So we're just trying to think of ideas for what we can do for the deaf and hard of hearing community and exploring options for that right now.
You are doing amazing work, Holly Rioux, on the Deaf Services team from the Greater Nashua Mental Health Center, and you've just laid out a very impressive to-do list. Clearly, there's a need for some resources. What is your basic pitch to our audience to ask them to invest in what you do every day?
So things that your donation will help with is expanding our deaf and hard of hearing services and resources that we can provide to the deaf and hard of hearing community. And that could include creating a position for an interpreter or creating solutions for crisis response. And that's mostly those two things are our current needs right now. So.
That's wonderful. Well, Holly, thank you for all that you do. Many thanks to our ASL translator, Kelly, who's off camera, that helped us with this conversation. But thank you for your eloquence, Holly. Thank you for this work and for enlightening us, because I feel many people don't know much about this program and need to know about it. So thank you for shedding some light on it.
Thank you for having us.